Welcome back to Fox 13 News Live at 5:30. More changes are coming to Utah's medical cannabis program. A series of bills is moving forward on Capitol Hill addressing medical marijuana.
Fox 13 News reporter Ben Winslow is on the Hill with more.
A pair of bills on medical cannabis make some modifications that patient advocates say do some good things for access in Utah.
I was telling patients, look, these are decent bills. Because they were posting, tell me what I'm supposed to hate. I'm like, nothing yet, which is wonderful. We've come a long way since 2014.
Christine Stenquist has been a critic of Utah's medical cannabis program in the past, but she's okay with a series of bills making their way through the legislature now.
I think it's maturing. And
bipartisan bills introduced on Capitol Hill make some changes to the medical cannabis program.
Making sure that, again, patients have access like they were meant to be based on the program that we created here from policy.
Here's some of the big ones. More types of providers can recommend cannabis. There are tweaks to advertising rules. Courts will have to recognize medical cannabis. School nurses can provide doses to a child that's a medical cannabis card holder. And some people can be offered cannabis post-surgery.
Patients being able to go and access medical cannabis instead of an opiate after surgery is a win for all of Utah with our opiate, crisis.
One thing the legislature is cracking down on is synthetic THC called Delta 8. It's been popping up at store kiosks, even though it's technically illegal.
Somebody's always pushing the envelope. And that's what's kind of happened. That envelope has been being pushed and putting it out there, so we're trying to rein it back in.
There's mixed reaction to that. The Utah Patients Coalition supports Delta 8, while Truce says it opposes it.
This extraction process was a health concern for the public, and we felt standardization needed to be in place before we put the cart before the horse.
The legislature is reaffirming that first responders can use cannabis with one big exception. Because of federal laws surrounding guns, police officers cannot use it.
The recommendation in the bill right now is that a first responder other than law enforcement could be a medical cannabis card holder and a patient, but they could not use the product within 12 hours of going on shift.
This is a year, I think that, we're kind of evaluating what we have and seeing how we can make it work better.
And in related news, the House of Representatives passed a bill for a task force on whether Utah should consider medical use psychedelics. That passed on a stunning 68-1 vote. It now goes to the Senate for consideration. On the Hill, Ben Winslow, Fox 13 News, Utah.